Good morning, students. Good afternoon or good evening, whichever it is that you're watching this. Welcome back to sort of talking about frozen sections. Oh my, hold on. So sorry about that. So we need to have a discussion in terms of different scenarios that you may wind up getting yourself put into. These scenarios are in your uh, packet of assignments and labs that's shared with you on Canvas. I'm so sorry. Yeah, every single one of these scenarios has actually happened to me. So we're going to go through here and, there's no really right or wrong answer how you're going to react. But because these scenarios have happened to me, I'm going to sort of help you walk through what you could possibly do to ease the tension off of yourself, and reasons why I reacted the way that I did react. Yeah, and how to better, sort of prepare yourself if you find yourself in these situations. So we're going to talk about these frozen section scenarios. And in the end, I hope that it helps you sort of digest the possible scenarios that you can find yourself in. And if they happen to you, react a little bit better having this knowledge. Now, knowing that frozen sections are very high stress, the patient is on the table, everybody is under pressure from yourself to the pathologist to um, to the surgeon that's waiting on results in the OR, to the OR staff. They're sort of hanging out, waiting for us to do our job so that the pathologist can report back into the OR. So I'm just going to walk through these, give you a brief explanation of, how it went down, how I reacted, how the pathologist reacted to, how I reacted to the pathologist. Yeah, and in an attempt again to help you better navigate your way through frozen sections. So the first one, you're in the middle of cutting a frozen section, and the OR calls and says that they have another frozen section for you, but they don't have anybody to bring it to the lab. The runner from the OR to the lab is unavailable. So what do? Well, the first thing you do is find a way. Yeah, find a way to get somebody down to the OR to pick up that frozen section. We do not want to leave that patient under anesthesia for a long period of time. Yeah, so you holler out. Yeah, you can send down anybody in the laboratory to pick it up. You can send a lab assist down. You can send another histotech down. Find somebody who is in the midst of something that they can hold. Yeah, if they're doing special stains or, a microtomist, if they are able to stop at that moment and then better, your first choice for me would be a lab assist who can actually stop doing something and just run down to the OR and bring it back. Um, you can also see if the OR has anybody that within a few minutes could run it or meet you halfway with it. But somehow you have to find somebody to go get that frozen section. And everybody in the laboratory knows this. So most people are just very helpful. I got a stop point here in 2 seconds. I'll run down and pick it up. So the second scenario is you complete a frozen section and you give the slide to the pathologist, and he tells you that the orientation of the specimen is incorrect. So this happens, every once in a while, and it's okay, don't panic. All you have to do is confer with that pathologist to see what orientation, have him look at that block, see what orientation he is looking for, and then you quickly pull that block and warm it up in your hand, gloved hands, warm it up in between your two hands, pluck out that frozen section out of the OCT and flip it and re-embed it, and then cut it again. Do it as quickly as you possibly can, but assure the pathologist that you're gonna fix it, you're gonna reorient it. It's just like melting down a block and turning it. Yeah, but make sure that you know what orientation that pathologist is looking for. The third scenario is the pathologist is a helpful person, and you're cutting frozen levels on a skin sample, and he offers to stain and cover slip that first level. So when the pathologist cover slips the first slide, he cover slips the wrong side of the slide, and when he wipes the back, he wipes that section off. Well, once that happens, and I had a helpful pathologist, but once that happens, you know, in the future, it's best to just simply tell that pathologist, you know what, I've got this under control. If you step in, I'm going to get confused where I'm at. So I'm good. I'll give you that first slide here in a second. Thank him or her for offering to help. But consequently, you sort of know in the back of your head that this helpful pathologist isn't really going to help you. So try to deter him in the future or her in the future. That would be your first thing to think about. The second thing is once that level's gone, that level is gone. So that means that the second cut that you have taken off of that frozen section becomes your first level. The third cut that you have taken off of that frozen section becomes your second level. And then you're going to go back and you're going to take another cut, and that's going to become your third level. Now, there's not much that you can do about that first level once it's been wiped away. But what you can do is sort of adjust your levels. And I wouldn't throw that very first slide away in terms of throwing it into, the biohazard. I would actually keep it. I would soak it in xylene. I would flip it over and I would cover slip what remains on that slide. And while he's looking or she is looking at the other three, you can repair that very first one, even if there's just a little bit on that slide. And then take it to that pathologist and say, this is the one that you wiped off. I don't know if you can see anything that's helpful on this level, but here's that very first slide. And that pathologist can take a look at what remains and see if there's any helpful information on it. I would keep that slide, and I would label it wipe off level 1, number 1 attempt, right? And then you would have that attempt in the file. And then you would have your level 1, level 2, and level 3. But the reality check is that level 1 would truly be a second level, but you have to adjust forward so that you have 3 complete levels in the file and then your attempted level that got wiped off. So the next scenario is a pathologist is aggravated from the very beginning, having a bad day, okay? You cut the frozen section, you stain the frozen section. And as you're staining it, you guys have plastic ones, but we used to have little glass containers that were lined up in our frozen section. And as I was staining the frozen section, the tink, tink, tink of the glass on the side of the glass thing as I'm moving the slides was irritating the pathologist. This particular pathologist came over He walked over to me and he grabbed that slide out of my hand and he threw it into the sharps container. Then he proceeded to tell me that the tinking on the glass was driving him absolutely crazy and that it was an unacceptable noise, and he could not tolerate it. Whatever you do not go back in and pull that slide from the sharps container. That's a bad safety no-no. So what I did, is I said, gosh, gee, I'm sorry. Yeah, keep your cool because, uh, um, combating an angry person only makes them angrier. So keep your cool about you. I just said, gosh, I'm sorry. I didn't realize I was doing that. I'll cut another one. You go back. This is why you never take that frozen section out until you get that golden answer of put it through. So I went back, I cut another section, proceeded to stain it very carefully without tinking, tink, tink, tink on the glass. Yeah, cover slipped it and gave it to him. When all was said and done, yeah, I waited a while, a couple hours. Yeah, and I didn't go directly to him, but rather every pathology department is going to have a director of pathology. This is one of the pathologists that's in charge of all of the pathologists. So I asked the director of pathology for a sit down, just a quick minute sit down, explained what happened. And he said that he would talk to the other pathologist, which good enough answer for me. Okay. Unfortunately, later, months later, we found out that that particular pathologist had a brain tumor. And um, that sound, that tinking sound, when somebody has a brain tumor, usually high-pitched noises are one of the first indications that there's something wrong. And so that tink, tink, tink on the glass agitating him was actually not his fault. It was, the fact that he had a brain tumor developing. So just a word of caution when weird things like this happen. Most of the time, there is some sort of underlying something that you don't know about. So always keep your cool, always, stay stoic. And, don't assume that that pathologist is biting at you or barking at you because that pathologist is sort of attempting to, be aggressive with you. That pathologist had a valid reason for that to happen, yeah, even though at the time nobody knew. So keep that in mind. All right. So the next one is a courier arrives with a frozen section and a biohazard bag. Now, this situation was a breast frozen. And oftentimes with breast frozens, they will take that piece of tissue and they will take it to radiology first, and they will x-ray that tissue to see if there's any little breast calcifications in it. Now, we've talked about why breast calcifications are very important, because that's the place where the first cancer cells are going to show up. So they will do this thing prior to surgery with these patients. They will x-ray the patient first, and at x-ray, they will place a probe, a little tiny wire, that from the outside in, that will point directly at those little calcifications in the breast. So there's a little wire pointing. So when they remove that, the surgeon knows exactly what area they're going after so that they do collect those little calcifications. Then when the biopsy comes out, they will take it down to X-ray and they will X-ray it to make sure that the surgeon got those little microcalcifications. Then the frozen section will come to you with the probe still in it. Yeah, and that gives the pathologist, when he's taking the sections, it gives the pathologist the direct area that we need to collect and do the frozen on. So this particular scenario, the breast sample had gone to radiology. And then the courier brought it to us. When the bag arrived to us, there was nothing in the bag. Okay. So what do you do? What happened? Where did the specimen go? In this instance, the radiology department was, in a different building right outside the hospital. So the courier had walked, across the parking lot to radiology, the actual X-ray came back with him. So we know that it hit radiology. Yeah, but somewhere in between radiology and the pathology department, that specimen disappeared. So what did I do? I walked with this courier and we retraced this courier's footsteps. As it turns out, the radiology department had not sealed the bag. And when the courier was walking back, he held the bag upside down and that specimen slipped out in the parking lot. And unfortunately, it got ran over in the parking lot. But there were pieces of it, still sort of smushed along the way. And so they were covered in dirt, they were covered in pine needles. But I did the best that I could to sort of collect these pieces, bring them back to the pathology department. And I had to wash them off in the sink to get all the pine needles and dirt and stuff off of them. Of course, I alerted the pathologist as to what was happening. And because I had put them in, water to actually clean them off, that was my first mistake. I actually should have used 100% alcohol if I would have been thinking a little bit more clearly. I would have gotten a flask of 100% alcohol and just washed the specimens, the pieces of the specimens in 100% alcohol. But I didn't. I washed them in water. I patted them dry. And then at that point, I thought, oh no, I actually did that. I actually washed them in water. So my thought process under the stress, I got some sucrose, 30% sucrose, and I sort of dipped them in 30% sucrose. I patted them off, to try to reduce the ice crystal artifact on the outside of these specimens. As it turns out, we wound up sort of taking the edges off of the specimens, and just getting into the middle and taking the frozen sections, as much of the frozen sections as we could, that had not been rinsed underwater, so we just took the inside pieces and froze those. And then all the outside pieces that were sort of mucky, we put those through for permanent. In the end, the frozen sections that came out did not have any calcifications in them. But we put all of it through, all of it that we could salvage through, and we did actually find those calcifications. So it worked out in the end for the patient. However, that's not the end of the story. We actually turned in that courier for, not being cognitive of the actual specimen in the patient in the first place. And the courier got fired, as well as the person in radiology who did not seal the bag in the first place. So a couple of people lost their jobs over it. But thankfully, in the end, the patient was given a proper diagnosis. So the next scenario, you're in the middle of performing a frozen section, and the pathologist turns to you and tells you that they have excruciating chest pains. Absolutely, totally happened to me. My pathologist had a heart attack. And, at that point, most of the time there's somebody else in the lab. But depending upon, the personnel that's in the lab, you can have, somebody take over that frozen section. You can continue to do that frozen section, but the very first thing that you do, of course, is yell out, "Help, are you okay?" Somebody call 911. And in fact, we were in the hospital, so rather than call 911, we called downstairs to the ER. And they called a crash team. Yeah, and the crash team came up and took care of the pathologist. Yeah, thankfully he turned out to be okay. But there's still a patient on the table. So you have two things to consider. You have your pathologist who's having a heart attack in the lab, and you have the frozen section. So first things first, right? Immediate, intimate danger. So the pathologist who is in imminent danger would come first over that patient that is actually in surgery. And the reason for that is because that patient that is in surgery has a medical team with them. Your pathologist does not. So you need to get your pathologist help. And you can call into the OR and you can say there's been an emergency. We're going to have to delay this. We're going to have to defer to perm, which means defer it to permanent section. But your other pathologist that is there will make that telephone call to the OR. Or, someone can step in for you while you're dealing with your pathologist. The next thing is you performed a special stain for the pathologist earlier in the day. Yeah, the special stain was unacceptable to that pathologist. Then they're called to do a frozen section. They walk in, you walk into the room, you see the same pathologist. And that pathologist just will not let it go, right? So as you're cutting that frozen section, your pathologist is still barking at you about why that special stain failed. What do? Well, first of all, you're the one who actually sent that failed slide into the pathologist. So yeah, it's kind of your mistake, right? But you own up to it. You always, always own up to it. So in my situation, I just said, yeah, I know I shouldn't have sent that in to you. That is my mistake. I already have it being redone. We are in the midst of staining it right now. It's gonna be to you in time for you to read it today. But right now, I need to focus on making sure that the frozen section is done correctly. Yeah, so if you could just give me a minute, we can talk it through when I'm done. Hand him the slide, let him read the slide. When he's done reading the slide, and he's called into the OR and he's told you to put it through, then you can say, gosh, that put me under some pressure, I promise I'll get that special stain to you today. It's on my list of things to get accomplished right away. So sorry about that. And usually they'll back down. Remember, never meet anger with anger. The next thing, you go to the cryostat to do a frozen section, and the lid is open. Okay, you open the lid and well, the lid isn't open, but you open the lid and your cryostat is warm. That means that the compressor has failed, and the instrument needs a repair. So if that cryostat is warm, you can't cut that section, okay? But what do? You have a backup system in place, and that's a touch prep. Yeah, so you let the pathologist know that the cryostat is under, needs repair. You can't do a frozen section. Yeah, most labs will have a backup cryostat. It may not be the best of cryostats, but it is usable. Um, in which case you can use the backup cryostat. But if you do not have a backup cryostat, then you simply just do a touch prep. And your pathologist can, instruments fail, your pathologist most likely will understand that. And he'll cut the specimen and say, okay, let's do 3 or 4 touch preps right here in this area. And you do a touchy, touchy, touchy on the slide. And then you fix it in that 80% and you run the H&E on it. You're called to do a frozen, you walk into the room, the cryostat's gone. Yeah, your supervisor failed to let you know that they had lent it to the derm path office for Mohs surgery over the weekend. So again, the derm path office is 1 floor above you. What do? Well, there's 2 possible scenarios. I just ran upstairs. I took that specimen. I had the pathologist cut that section for me. I took it upstairs. I went. I did the frozen section. I cut it up there. I came back down to the lab. I stained it, handed it to him so it could be read. The other option is the same sort of scenario. You can always talk to your pathologist and see if they would rather, because that takes a little bit more time, right, to run upstairs. So you can always talk to your pathologist and see if they would prefer to do a touch prep. All right. The next one. You receive a phone call from the pathologist who's performing the frozen with another tech. The other tech got angry for some reason or circumstances unknown and walked out. Yeah. So when you arrive, the pathologist is fuming mad with the other tech. What do? You walk in and save the day is what you do. You walk in and say, I'm so sorry that happened. I don't know what's going on, but I'm here to save the day. Where was that tech at? You take a look, if it's still freezing in the cryostat, if the frozen section is still at the growth station, you look at where the process is. And you step in and you say, you know what, I'm going to do this as fast as I can. We're going to get this done. Give me a minute and I will give you that section. Yeah, deflate them. Okay. Tell them you're there to save the day. You're going to take care of this situation. You don't know what happened with the other tech. But that's not where you are. That's none of your concern. You're there to save the day with the frozen section. And that pathologist will sort of decrease and say, oh gosh, thank you. Thank you. We really need to hurry on this. Hurrying as fast as I can. Okay, I'm gonna get this done for you. Give me just a second. Okay. The next one, you're performing a frozen section when another frozen section arrives 5 minutes later, and then another one after that. So you have 3 frozen sections lined up. Okay. So what do? Your pathologist is sort of panicking, thinking, oh my gosh, you're never going to be able to get this done. You're going to get them all mixed up. Here's what you do. You're going to have a requisition with each one of those. Okay. So you get 3 different grow sinks. And when the pathologist, when you're on the first one, right? You take a little stick, you put it in, say, green ink. You dot that requisition with green. Just put a little green dot on it. Then you dot your section. Or when you're freezing your OCT, you can put a little dot of green ink in that OCT. That way you know which patient it belongs to. That second one comes in, use red ink. You get a stick, you dot that requisition with red ink, you dot that OCT, or if your pathologist is going to ink a margin, you ask them to ink it with red ink. Third one comes in, use black or use yellow. Yeah, and that way your blocks that are in the cryostat waiting for the magic words of put it through, you know exactly which patient it is because you've color coded them. It's a great trick of the trade. Okay, so those are all the sort of weird scenarios that have happened to me during frozen section. Yeah, it they all turned out to be, okay. Yeah, you just have to keep calm, keep steady, know exactly what you're doing when you're doing it with each patient. And over time, you're gonna get to the point where you sort of build a rapport with your pathologist, and once they trust you, then they sort of relax on you. When you're new and they don't know how well you're going to perform, they're a little anxious. So you got to give them that. Some are very gracious, some are very stoic. Yeah, but you will start to learn their personalities and build a rapport over time. Yeah, and you can work together professionally. The biggest takeaway from this is always remain calm. Always remain calm. Don't meet anger with anger. And uh, don't snap back. Okay. You can diffuse the situation. You can, understand why there are extreme moments when we're doing frozen sectioning. Yeah, because, it's all about that patient that's on the table. But just stay calm and carry on, and you're going to be fine. Okay. Bye for now.